Now we want to turn to the worsening healthcare crisis. We've been following this, for a few years now.
Yeah, the number of nurses getting into the nursing practice is not keeping up with the demand in hospitals. A lot of nurses deciding to resign or to choose another profession because of stress. NewsNation has investigated this story thoroughly. And as so many nurses, they're not leaving the industry entirely, but they're shifting their roles for jobs that aren't quite so burdensome. Stephanie Haynes is joining us live to talk about nurse burnout. I know you spoke to members of the community there with real concerns about the future. And we've reported on this, that so many are telling us that nursing itself and the medical industry are facing a huge crisis.
Yeah, exactly, Adrienne. It's just like what you said. What's increasingly happening here is that nurses are leaving their jobs in settings that are very intense, like hospitals, and going towards the more outpatient settings that may not be as stressful. But the issue is some say there needs to be policy, there needs to be incentives to try to keep nurses in these hospital settings just for your sake, for the patient's sake.
Medical strikes are turning heads, signaling to providers and patients all over the country the healthcare industry is not okay.
It's not a shortage. There is a staffing crisis that needs to be dealt with in this country.
The American Association of Colleges of Nursing cites data from the Bureau of Labor Statistics, which shows the RN workforce is expected to grow by another 200,000 by 2031 and projects more than 200,000 openings each year when taking retirements and resignations into account.
The concern is that with all these changing times, all these other opportunities now available for nurses, like retail healthcare, pharmacy, and outpatient care, which is actually a lot of care is shifting now from inpatient to outpatient. So there's emphasis on that. And that's much less stressful environment for nurses to work in.
In a memo sent out back in March, National Nurses United wrote, there is no nurse shortage. Instead, nurses are leaving for, quote, a more sustainable profession after repeatedly working under conditions that are unsafe. The union says more than 1 million registered nurses were not employed as RNs in 2022, that the number of students passing the nurse licensure exam is increasing year over year, and that most of the workforce is growing outside of hospitals and acute care settings.
There's a reason for that. When there's a true shortage, it means that there aren't enough people going into the pipeline willing to do nursing, or they're not staying. Now, this is a case of people not staying, it's true, but it's why. And the nurses have been very honest about it for years now. We can't continue to do more with less.
We reached out to several hospital groups and didn't hear back. The American Hospital Association maintains that they are willing and they continue to support their workforce. The Biden administration back in August awarded $100 million for this issue alone to try to help groups train up the workforce for nurses.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.